Hello guys, so here we are bringing to you ready to write series. It's regarding the questions which are very important and are meant to be written properly in the exam. So many of the times we read the topic, but then we should know how to frame an answer and how to represent it in our exam. So here are some topics for the same. First is tissue conditioners. Here is the contents for the answer. First of all is introduction. In this we are supposed to write why we need tissue conditioner sometimes, or why there are some type of clinical conditions which we see in the patient in which we need to use tissue conditioners. So followed by definition. It would be good if we write a definition from the recent GPT, that is GPT 9. Third is history. Fourth is classification and types of tissue conditioners, followed by ideal characteristics of tissue conditioners, composition and role of every constituent, then mechanism of action, then indications, contraindications and limitations of tissue conditioners, then uses of tissue conditioners according to different powder liquid ratios, advantage and disadvantages, then techniques for denture relining, steps for denture relining, and recent advances. Now I have explained some of the parts further in detail. Like for classification, we have 5 types of classification for tissue conditioners. As for from ISO, there is short term and long term. From DCNA, we have short term, long term, and intermediate term based on the duration. Like short term liners, they are used up to 1 month, whereas intermediate term can be used from 1 to 6 months, and long term can be used as long as more than 1 year. Third is acrylic and silicone based liners. This is very basic classification. And then again these are further classified as heat cure and self cure type of liners. Then next is McCabe classification. They have classified as hard reline, tissue conditioners, and soft reline. Whereas according to Phillips, it has been classified according to the materials like acrylic liners, silicone liners, vulcanite rubber, polyurethane, and polyphosphazine. Next is desirable properties which are needed for an ideal tissue conditioner. So among that we should write about adequate compliance, then dimensional stability, adherence to the denture, color stability, like it should be it should not lose its color. Then adherence to denture is it should be properly adhered to the denture. Then biocompatibility, low solubility, etc. Then followed by ideal properties, we need to write about composition and functions of each constituents. Like we know that a basic composition for tissue conditioner is powder and a liquid. So powder is basically a polymer and liquid is basically methacrylate monomer. Then next we have function of solvent and plasticizer. These two components, they play very important role in the tissue conditioner. Solvent, we usually use ethanol, whereas plasticizer there is dibutyl phthalate. So how this plasticizer, it gives the property of viscoelasticity to the tissue conditioner. So that we need to mention about the property of viscoelasticity. That is the next point. Followed by that, then mechanism of action. It is same as that of viscoelasticity. How when we mix powder and liquid, how there is gelation formation and how that gel gives the property of viscoelasticity to the tissue conditioner, and how it is advantageous to the denture. That we need to write for mechanism of action. Next we have indications, contraindications and limitations. That is clear cut given in every book. And then next we need to write about the uses according to the variable powder liquid ratio. Like if we are using it for tissue conditioning, we need to use powder liquid ratio as 1.25:1. Or if we are using it for temporary obturators, we need to use powder liquid ratio as 1.5:1. For stabilization of dentures, 1.75:1, whereas for secondary impression, 1.5:1. So these are the variable powder liquid ratio. Accordingly, there are variable uses of the tissue conditioner. Then advantages and disadvantages. In advantages, we can write the various type of effects which we see in the patient after using the tissue conditioner, like increased comfort to the patient, or increased retention or stability to the patient. Or if there is mucosal soreness before, then that mucosal soreness gets decreased after the use of the tissue conditioner. That we need to mention in advantages. Whereas in disadvantages, we need to mention about the properties of the tissue conditioner after some point of time. in which the plasticizer it deteriorates, or its gelation properties it decreases, it loses its color. Then many of the tissue conditioners, they have ability to form the colonies of the various microorganisms such as Candida albicans, which is very much common. So that we need to mention in disadvantages. Next comes about techniques and steps for relining. So in this case we need to explain what are the procedures we carry out at the time of the relining. Like what are the changes we make in the denture. We trim the denture borders by around 1 to 2 mm, and then we go for the relining. So there are two methods, direct method and indirect method of relining. So about that we need to mention. And lastly, recent advances. Do not forget to add recent advances in every answer. Like you should add it as much as you can in every question. In recent advances, some of the names for tissue conditioners are polyphosphazine fluoroelastomer, polyurethane, hydrophilic acrylics, higher methacrylate tissue conditioners, conditioners with titanium oxide catalyst, and products with undecylenic acid. So this titanium TiO2 catalyst thing is, it has one specific advantage, that it does not allow the colonies of Candida albicans to form. So this is the main advantage for this fifth one. So next topic for ready to write series is mandibular movements. In this, what we need to write is firstly introduction, like how mandibular movement is helpful, or why mandibular movement is needed for every type of the activity we do in our day-to-day life. Next is role of temporomandibular joint and muscles in mandibular movements, how the TMJ and muscles they play a role for the every type of mandibular movements, that we need to write like in short, not in too detail. Nextly, there is determinants of mandibular movements like condylar guidance, incisal guidance, and neuromuscular factors. So we need to write about these three factors. Then next is types of mandibular movements. Now here is the classification of the mandibular movements which we need to write about. First is based on extent of movements, then next based on type of movements, and next based on dimensions of movement, among which we have border movements and intra-border movements. Nextly, there is effect of mandibular movements on occlusion, then parafunctional mandibular movements in short, and lastly methods to record mandibular movements. Among this, I have just written the headings of the types of mandibular movements just to brush up. First is based on the dimensions of movement. We have rotation around the three axes, that is transverse or hinge axis, anteroposterior or sagittal axis, and around the vertical or frontal axis. And fourth is translation in time. Whereas the next classification is based on the type of movements, where we have hinge movement, protrusive movement, retrosive movement, and lateral movement. In lateral movements, again they are classified as lateral rotation movement and Bennett shift. Now among lateral rotation we have 5 types of direction of the condyle, that is laterotrusion, laterosurtrusion, laterodetrusion, lateroprotrusion, and lateroretrusion. So this 5 types of rotation of the condyle needs to be written. Next is Bennett shift, again which is subclassified into immediate side shift, precurrent side shift, and progressive side shift. So we need to write about this. Now next is based on extent of movement. In that we have border movements as well as intra-border movements. So in border movements we need to write about horizontal, sagittal, and coronal plane, and corresponding tracings like diamond shaped tracing, shield tracing, and beak shaped tracing. For intra-border movements we need to explain about chewing, and its chewing gives teardrop shape of tracing, that we need to mention. Then next, followed by this, we have to write about the envelope of motion, which was given by Posselt in 1952. So this is nothing but the combination of all the three movements of horizontal plane, sagittal plane, and coronal plane. So this combination of these three planes, Posselt has symbolized it in a single diagram. So that is called as envelope of motion. Nextly, there is effect of mandibular movements on occlusion. That is, we need to explain the effect of movements on the occlusion with respect to Bennett angle, as well as the incisal guidance, that is as per the slope of the anterior teeth, how the mandibular movement is affected. Nextly, we need to write about parafunctional mandibular movements, that is in case of bruxism or clenching or any type of habitual movement which patient may show which is different than that of the functional movement is called as parafunctional. So we need to write about this, that in some patients we also see some type of parafunctional mandibular movements which are not that regular and which may harm the temporomandibular joint and muscles, so they should be taken care of. So after mentioning about parafunctional movements, lastly we need to write about the methods to record the mandibular movements. So we have almost 5-6 methods. So first is ultrasound, by using the ultrasonic motion detector, accelerometers which detects dynamic motion of the jaw. Third is video fluoroscopy with the help of the continuous X-ray to detect the motion of the jaw. Fourth is cineradiography by injection of non-toxic radio-opaque medium or dye. And fifth is Arcus Digma, which is the bite registration system. So these are some of the methods to record the mandibular movements. Nextly, we move on to the next topic of ready to write series, that is systemic diseases in concern to prosthodontics. Now this question is something which is very descriptive and you need to know about many type of medical diseases in this case. So let's see what all right and what are not. Firstly, introduction, that why like how the systemic disease is present in many type of individuals which comes to our clinic. So that we need to write in an introduction. Then how we need to check those systemic diseases, that is by recording the medical history. So we need to write about medical history and its importance. Now third point is basic protocols for appointment schedule. Like in for various types of disorders there are various types of appointment timings, like for diabetes or hypertension or asthmatic patients we have different type of appointment schedule. So that we need to mention, and a basic protocol, like mostly patient is called in early in the morning or after having a proper breakfast, or we should not make the patient to sit for so long. So that is all the basic protocols which are to be mentioned there. Fourth is stress reduction protocol, that we usually know, so that we need to write about. Next point is something from where the main answer starts, that is to explain the various systemic disorders, their dental significance, clinical feature and dental management. As you need to write about many diseases, so it's better if we focus only on the dental part of the every disorder. Now first of all, there is cardiovascular diseases. In that, major disorders what we have is angina pectoris, myocardial infarction, subacute bacterial endocarditis and hyper and hypotension. So basically when you write about these diseases, you just need to, suppose if you are writing for angina pectoris, then just explain what is angina pectoris, and if the patient has suffered previously from angina or recently he has suffered from angina, then what are precautions we need to take during the dental treatment. So that we need to write, and if there is any type of dental emergency, how we are supposed to manage it, that we need to write. So just segregate your answers in the headings, that's it. Next we have endocrine disorders, among which we have thyroid, diabetes mellitus, which is very important and can come as a separate question too. So diabetes needs to be read in detail with type 1 and type 2 disorders. Next we have adrenal gland disorders. Then followed by endocrine we have hematologic disorders. In that we have anemia, leukopenia and hemophilia. Then followed by that we have bone disorders with osteoporosis, osteoarthritis and rheumatoid arthritis. Next we have oral submucous fibrosis and xerostomia. Xerostomia has been explained in our video of saliva and its role in prosthodontics in detail. Neurologic disorders, in that we have syncope, stroke, epilepsy, Parkinsonism and Bell's palsy. Then next we have mucosal conditions. In that we have basically vesiculo-erosive lesions, then systemic lupus erythematosus and burning mouth syndrome, and lastly HIV, which is very important. And we can also add a short note on COVID, because that is the pandemic which has occurred and still going on, like very recent thing. So if you add a note on COVID, that would be good. and also we know much of the things about its protection, so we can add much more about COVID disease also. So basically for this type of questions, what we need to know is uh, a basic, like what the disease is, what happens in the disease, then what is the dental significance of the disease, and how to manage the disease if there is any type of medical emergencies occurring on the dental chair. So these are the 3 to 4 things which you need to know. And most important, the pre-medications if we need to give before any surgery, so that you need to mention. Example, in subacute bacterial endocarditis, if you read it, you will come to know about the pre-medications before every surgery which is to be given to the patient. Next ready to write question is psychological implications of patient care in prosthodontics. Now, though not mentioned here, this question is more to be emphasized for geriatric patients, because many of the psychological implications, they are more concerned to the geriatric patients who are old aged. So introduction should be written that why the psychological condition is important to judge for every patient, and with special emphasis on geriatric patients. Now, after giving on special emphasis for geriatric patients, we can move on to the effects of aging in prosthodontics. Now, effects of aging in prosthodontics has to be written with respect to skin, with respect to teeth, with respect to every type of system like GIT, or bone. What is effect of the aging on the bone? So various points we need to explain for effects of aging in prosthodontics, followed by appointments guidelines for the patients. Now, how we need to handle the patient when patient comes to the clinic, so that we need to write about, followed by medical history, which is very very important, that patient may have some or the other psychological type of disorder going on, or patient may be under the medication of the same, so that we need to judge, and this we can only judge by recording the help of the medical history. Next comes psychological conditions experienced by the dentist. Basic personality traits for the patient, like how the dentist should be for the patient. This is something which comes under the basic personality traits. How the dentist should behave with the patient who is psychologically compromised, or like any ordinary patient. Next is classifications for the patient's behavior, and explain the classification. Like we have for a house classification of the patient, like philosophical and hysterical, etc. Then also we have Frankel's classification of patient behavior. We have Winkler's classification of patient's behavior. Like 3 to 4 classifications you need to write, and you need to explain about the same, that what type of patient shows which characteristic, and how to identify that patient. Nextly, we have treatment plan formulation. In that case, what we need to write is, suppose a patient come who is completely edentulous. So what all treatment plans can be for the patient? The patient can be given removable complete denture, or the patient can be given implant supported over denture, or the patient can be given implant supported fixed denture. So what all treatments can be given to the patient, and what are the advantages and disadvantages of the every type of treatment, so that needs to be explained to the patient, so that which forms the next point, explanation of advantages and disadvantages of clinical procedures. So basically, in treatment plan formulation, you need to explain to the patient the multiple type of treatments which can be given to the patient in order to rehabilitate the jaw. So that you need to explain to the patient, followed by the advantages and disadvantages of every type of the treatment plan you have explained to the patient. And after that, lastly, you need consent from the patient for every clinical procedure you are performing on the patient. So you need to formulate a consent accordingly, and get the consent signed by the patient by explaining him or her the every type of the thing he or she is going to face during the surgery or after the surgery. Now, explaining about the psychological conditions experienced by the dentist, there may be many, but then mainly we have anxiety, depression, conversion hysteria, and body image disturbances, which we usually see in the patients. Among that, also anxiety and depression, those are the most common conditions which we see in the patient. Next is basic personality traits for the patients, like how the dentist should be for the psychologically challenged patient. So how the dentist should behave: the dentist should be agreeable, he should be good listener, he should avoid arguments, he should criticize tactfully, he should not be too egoistic, then he should remember the names and faces of the patient. Like when the patient comes after so long, 1 or 2 months, suppose if the dentist remember his name or face, or if the dentist addresses the patient with his name, the patient feels psychologically very comfortable. So that thing needs to be followed. And lastly, he should be interested in others, like he should be interested in listening to the patient, his or her problems. So these are the 7 basic personality traits for the patient. Just mention these are important. This is not given in some book, I have taken it from the article. So you just take care and write somewhere, note it down. Lastly, all the very best. Hope this small discussion would make your exam more easier. If the question comes in the paper, hope you can write it and represent it neatly and beautifully. Thank you once again, and all the best.